Hey, good afternoon, everybody. Tom Stewart here. I'm with Dr. Gavin Macgregor-Skinner of GBAC, a division of ISSA. This is Smart Business Moves. Dr. Gavin, how are you?
Tom, I'm doing great. Really, what a great time of the year it is.
It is, in a lot of regards. The weather's getting nice, days are getting longer. Spring cleaning time, isn't it?
It is indeed. I don't know about you, Tom, but the allergies do get to me this time of the year, so I'm very cognizant of what goes on outside as well as inside where I live.
Yeah, that's a thing. And it kind of hits different parts of the country, different times. I'm further south than you. I'm South Carolina. We were wrestling with that probably 6 weeks ago. The pollen and that stuff's pretty much gone. But, I guess, we had a chance to chat a little bit. We were at an event together in DC a couple of weeks ago. And I think you guys were like in the middle of the cherry blossom situation. So I imagine pollen is maybe still a thing up your way.
Oh, Washington, D.C., where I live, Tom, is just the most beautiful place at springtime. With the over 3,000 cherry blossom trees that we have, when they all come out, and they came out probably at least 2 to 3 weeks earlier than normal this year for various reasons. But when they pop all at once throughout the whole city, it is amazing. But the allergies kick in. There's no doubt about it.
Okay. Well, this too will pass. And could you explain a little bit about GBAC, your background? You got a really interesting background, just for our audience's benefit. Have you ever done Smart Business Moves? It's been a while. Yeah, you have. You have helped us in a group setting.
I think it was a while ago we did this, but again, I'm just so grateful and thankful what you are doing, Tom, Made Central are doing, just getting messages out for the industry that really has to, be energized and consolidate and say, look, guys, you are doing a good job. We want you to be on a pathway of continuous improvement, but just want to say to all the cleaning professionals, you do an amazing job. And we had a great day back in April up at Rockville, Maryland. And the questions that we got, the amount of engagement from the attendees, Tom, I thought was fantastic.
It was an awesome group, a lot of energy. And, I've been doing this for a while and I've seen this whole thing evolve, and the level of sophistication that you see from the people who are operating house cleaning businesses today. We've come a long way in the last 20 some years.
And I do. And that's really what excites me. I know that members of my family are going, you do what now? You work for a trade association that does the clean industry with your back. What are you doing? But it's that potential, Tom. It's that potential to go to scale, to do something that's remarkable. And I'll tell you why I think it's so remarkable. I had 12 years in the military, which I just absolutely enjoyed. It was like a hobby. I just found the 12 years I had in the military, running around the world, doing conflict resolution, looking for biological weapons, was just, for me, a hobby. I really enjoyed it.
Wow.
When I left and I came into the real world, I worked for CDC for a couple of years as an epidemiologist or a disease detective, and I love that. Going out and trying to solve, whether it was animals or people getting sick, and working out the jigsaw puzzles of how that happened and putting that story together. And now I'm in the trade association. I'm with ISSA, the Worldwide Cleaning Trade Association. I'm representing people that I think need to be better represented. I'm working with people that I just admire so much, but I also see the potential to help them more. And I think this is the work that you do as well, Tom, is that the way that we can see that, you and I have both got job security. It's sad, but it's true, because people need our help, and we know that we can make a real impact. And I look at cleaning through the lens of science and evidence. I look at it through the fact that it is based on scientific principles. It's based on evidence, because we deal with chemical products that have chemistry. We deal with equipment, which is innovative and wonderful. And we deal with so many surfaces that it makes it just complex and intriguing, and going, gosh, I've just gone into a room and I've got 50 different surfaces. How do I clean this in a way that makes the room healthy and safe? And in some of the past experiences that I've had before coming in the clean industry was going to scale. I worked with tuberculosis for a number of years, and our goal was, how do we train 1 million people in a year? And everyone went, "No, you'll never train 1 million." We trained 1 million. We got to the stage where we could train 1 million people in a year using the same approaches, the pedagogical adult learning approaches, with the same standardized information to bring them up to the quality, the standard that we required to go save people with tuberculosis.
So tell us about that just a little bit. 1 million people in a year. So was that like globally, or what market were you in?
That was globally. We had the Stop TB partnership that was out of Geneva, Switzerland. I worked for the US government through USAID, and I worked with CDC. And the goal was here, tuberculosis was this is 10, 14 years ago. It was still increasing. It's still today a big problem in many parts of the world, even here in the US.
I read Long Beach, California, they had an outbreak of that within the last week or two. One person died and several are sick.
And this is where the similarities, the being in parallel with the cleaning industry, what we're trying to do. Yes, there was a way to, again, do surveillance and find the people that may have tuberculosis. There was a way to test them. And then there's a very important way through, it's called under the direct observation therapy. So you actually watch people take their tablets every day over like a 2-year period. There's a way to do that to ensure that you set the standard. So what was important was there was no real curriculum that was standardized to ensure that we got quality and safety. And we developed, a group of us all came together and said, let's make sure that curriculum's there. It's in place in many different languages. And we go out and we work out the training facilities that we need, the training guides, the instructors that we need, the logistics that we need to get to 1 million. And I look at that program, Tom, and go, wow, how can I translate that? How can I bring that over to the clean industry in the US, for example, and say, train 1 million? So if we look at, how many people do we think are in the clean industry today here in the US?
Oh my goodness. It's a meaningful number, hundreds of thousands. There has to be.
At ISSA, we think it's about 4 million in the US.
4 million. Okay, that I'll buy that.
And I'm going to take 4 million for both residential, commercial, people that go out and actually do the hard work, do the cleaning. So if we have 4 million in the US and you and I want to go out with a team of others and train 1 million, that's only 25%. Now, in my career, I've done that once. I'd like to do it a second time. And I'd like to be able to sit back and go, hey, I just trained 1 million people this year.
Do you have to put a program together, and it has to be something that can be scaled? So you got to be able to train trainers and maybe have trainers train trainers. I mean, it's like an exponential exercise, isn't it?
It takes a team.
Yeah.
And I think we have that team. We have the ingredients in the clean industry right now. We just don't have the glue.
Right.
And that's what's important. How do we create the glue to facilitate all these wonderful people that are out there that so many people do training, but to make sure the learning objectives are standardized, make sure the outputs and outcomes are standardized, make sure the assessment is standardized. Adults learn by doing. Let's go and, don't have them sit down in front of PowerPoints. Let's go straight out there and get them out there and work and do things and learn on the job, learn by doing, and put them on a pathway of continuous improvement, and then reward them for that.
But Gavin, there's, a lot of different perspectives on what training is and the value of training, especially, I'll narrow it down to house cleaning, the residential cleaning industry. There's a school of thought out there that house cleaning is something that just anybody can do, and give me a vacuum cleaner and a mop and I can clean homes, and it's nothing more than a chore that somebody doesn't want to do. And I think our training needs to start with that there's a lot of misconceptions in terms of the true value of cleaning. And if we could start with that, maybe we could at least generate a lot more interest in wanting people to learn more not only about how to remove soil from a surface, but your specialty with cleaning for health and the infection control aspects of it. I know a little bit about what you're doing. I mean, if there's a Ebola breakout halfway around the world, you're putting on a Ghostbuster suit and going out there to help. So you boil that down to cleaning somebody's house. Is there really, health benefits in terms of how well we clean someone's home?
Yes. Yeah. Oh gosh, Tom. Well, there is, and I think you've got to get. We know from just research. We know from publications. Where do you spend the majority of your time? It's inside, and work that's been done at many universities. For example, Harvard University has shown that the majority of us spend about 90% of our life indoors.
Wow.
So you live to the age of 80, that's 72 years you've spent indoors. And we're so worried about pollution and the climate and the weather and what's happening outside. We're not out there very often. We're inside. And then we come inside and we go, what's your air quality like? I don't know. But I know what it is outside because it says so on my phone. Tells me today, right now, the outdoor air quality in Washington, D.C. It gives me a score. It tells me whether it's green, yellow, orange, red, purple. But when I come indoors, I have no idea what the air quality is like. When we talk about that, the effect of cleaning when it comes to pollens, allergens, dust, dirt, and even before we get to the bacteria, viruses, fungi, mold, infectious disease pathogens, we're dealing with surfaces, Tom. And at the moment, we're very subjective. And what I mean by that is it's all visual. And if it's not visual, then it's smell. And we need to be more objective. And what I mean by that is we need to do more measurements. We need to increase quality in a way that quality is not part of competition.
Okay.
In a way that quality is a standard. And we need to, and if we can do that, again, you and I could both go and show someone who cleans a home and does a really good job, and then show, can you meet that standard? We can also do measurements and say, can you meet these standards based on measurement?
And, in this industry, a lot of the measurement is based on customer feedback, and it's a survey form. And for the most part, you're getting feedback on the overall experience as opposed to, maybe from the aesthetic standpoint, but certainly not from a infection control standpoint and the indoor, health standpoint. How do we measure? How do you measure that?
Yeah, here's the difference between tidying up, making an indoor space look neat and tidy versus actually cleaning, and then cleaning for a purpose. And a lot of us are cleaning based on visualization. But again, the challenges that I see amongst our colleagues, our professionals in the industry, is repetitive. When they go into a home, a resident, even a commercial building, you're dealing with hard, non-porous surfaces, floors, for example. Floors are, a big issue. And this is where one thing, Tom, that we found in the COVID pandemic, there wasn't a lot of attention paid to floors. Then you have a lot of soft, porous material, chairs, couches,
right,
beds, and we saw, we know how to clean those. We can do that. That's all doable, but that a lot of attention wasn't paid for that. And then suddenly our industry got pipelined and going, oh, you do bed knobs, bed knobs and light switches. I went, no, that's a Disney movie. We don't do Disney movies. We do science and evidence, and it's not about those those door knobs and those light switches. Yeah. It's about the whole inside of the building, the whole inside environment. So the measurement that we can do can be both visual, it can be subjective, as long as you follow the right protocols and procedures. And I get asked this a lot. About, what's a common area that everyone has to clean in every house? The bathroom. And every bathroom probably has tile in there, and every bathroom probably has grout in there. And, how do I clean that bathroom without destroying the grout or the tiles? Or I don't want to damage stuff. And so that leads us to where we need to be, Tom, is a playbook. what does that playbook look like? And I used to design playbooks for those Ebola outbreaks.
Right.
How do you clean an ambulance when you've had an Ebola patient in there? You go to the playbook. We wrote a playbook to how to do this based on quality and safety, and you followed the playbook. How do you clean the bathroom, the toilet area of a home? It's pretty much the similar materials. There might be a little bit of variation, but not a lot. And you do it in a way that's based on health and safety. And if we can do more, facilitate more assistance to the profession through training and education. I'm a big fan of playbooks. Take out the playbook based on the surface, how to clean it so we don't damage it, so we protect it, so we protect the cleaner themselves. That will then focus. We can then take another monumental leap into the business and go, just focus on your business, focus on your leads, your opportunities, focus on expansion, focus on doing better instead of worrying about the how. Let's fix the how first.
Yeah. And there's a synergy between the two, because if you fix the how, not only in the context of making the home tidy, I mean, that's just kind of the starting point, but there's so much more that should be included in what a clean home is, from, the indoor, environment. Who is it? Dr. Barry wrote the really thick book about that. That's kind of hard to find these days.
That one.
That's one of my favorites, actually.
Sits on my desk. Dr. Michael Berry's book sits on my desk all the time. Why? Because I am so passionate and I believe so much into his philosophy that all of us in the industry are managers of the environment to protect the environment. We manage health and safety in the environment. And that's the focus we should. It's not just cleaning up for the appearance, the smell, as many people have said since this book was published in 1993, so over 30 years ago. The fact cleaning for health is more than that. Yes, we do appearance, we do smell, but we also do health. The health of the building, health of the people, health of the animals, whatever it is, it's so critical. And I think taking Dr. Michael A. Berry's philosophy, his practices, his approaches, plus many others out there in the industry, and operationalizing them, put them in a playbook, put them in a way that people can go through any sort of training, Tom, and go, wow, I have the confidence now to clean any surface and do it safely.
That book's hard to find. I think ISSA sells it, doesn't it?
Oh, it's unfortunate. I would have loved to have done a reprint at 30 years, but yeah, it's hard to find now. I think it's based on the fundamentals of how to clean. That book is wonderful. But again, we're in the year 2024 now, Tom. People learn through videos. People learn through doing. People learn. So we have to take something like Dr. Michael Berry's book, Protecting the Built Environment, Clean Health, and work out how to train this generation of cleaning professionals in a way that works, has impact, the way that leads to change, leads to put them on a pathway of continuous improvement. So it's really important we take that. There's many other resources out there, and we put it into a way that adults want to learn today. And especially in our industry, the number of adults that we have that have different backgrounds, speak different languages, different educational levels, and make it work for everyone.
So the content, I guess, in Dr. Berry's book could be updated, but more importantly, it needs to be delivered in a more digestible form. I dropped a link to it in chat. If you're running a professional cleaning organization, you need to invest in this book, though. It is, I would consider it the kind of the starting point. It's the Bible that all the science of cleaning should be built off of. Am I going too far with that, Gavin?
No, this is perfect, Tom, because, the internet has changed everything for us. We years ago when we were all, we were doing this, we relied on subject matter experts and the opportunity to go and listen to someone. Now we have the internet, and through a search engine such as Google, we can search for stuff. Unfortunately, it also leads us to find information that I wouldn't agree with. And so that ensuring that the information you get from the internet is based on science and evidence is a challenge. I know it's a challenge for you. It's a challenge for me. So more importantly, the industry is at the right time right now to develop more of an academy university approach. I think it'd be wonderful for so many of the cleaning professionals in our industry to say, I went to an academy, I went to a university, I graduated, I achieved to know that when I clean a residence, I clean a home, I'm doing it in the best possible way based on science and evidence that I could do that.
And there are some countries in Europe, Northern Europe, that you can go to college and get a 4-year degree in cleaning. Is that not right?
Well, England, the United Kingdom, has just launched this year, January 2024, the first apprenticeship program for cleaning staff. And they're doing it in 11 different organizations. And now it's supported by the federal government, by the UK, the British government. And they have now set up an apprenticeship program. I know they've got a whole list. I think it's like nearly 25 learning knowledge, skills, abilities, learning points that you have to make in different modules. I've looked at the curriculum. I think it's fantastic, but it gives everyone the confidence and the recognition I think that people deserve, in that you could go through this apprenticeship program like an electrician, like a plumber, and bring us up to where I think we should be. Tom, we should be a trade. We should be looked at like a trade, as a trade, and people within the profession should be treated like a trade.
So after going through that program, are you then like licensed to be a professional cleaner? Or is there some, are there like in the US, there's a lot of trades. If you don't go through the apprentice process, and if you aren't licensed, you can't cut hair in this country without going through a process of being licensed. Is that what they're doing in England with cleaning?
Yes, and it's also leading. It's so positive. This is such a positive move for the industry, in that you don't just do the apprenticeship program. The apprenticeship program then guarantees you employment afterwards for so many months, and it works through a sponsorship program.
Yeah.
So this is a win-win for everyone. This is a win when we talk about workforce retention and high turnover. Now the government is supporting an apprenticeship program which requires companies to sponsor, and they know when someone graduates or is doing the apprenticeship program, at the same time they're cleaning the facility.
And it's not just a chore that somebody doesn't want to do anymore. It's a profession.
And they're doing it because they know what they're doing.
And
they learn the magic. They learn the magic of the science behind cleaning. They learn the fact that, hey, why does this particular microfiber cloth work better than this other material cloth? Why does this product with a solvent and surfactant at this pH work better on this surface than that one with a different pH? And then learning that simple science behind it. Like, again, you wouldn't want an electrician or a plumber to come into your house that hadn't gone through a formal training program.
No.
But we would let someone to come and clean our house. We would pay the money. And I say to everyone going, you pay a cleaning company to come into your house on a weekly basis to clean. What do? I don't know. What do you pay for? Oh, it looks fantastic. It looks amazing when they finish. What did you pay for? I don't know. Wouldn't you like to know what they did and how they did it?
And so much of the value that they're creating cannot be visually observed. And, the cleaning company has an obligation to help convey that to their customers. And if the cleaning company isn't doing that, the consumer very well might not be getting what they should be getting. The certification thing is interesting, though, because I know from a cleaning business owner perspective, a lot of times it's like, don't want to get the government involved, don't want to have to do that, don't want to make it more difficult. But I've seen studies in terms of how bill rates and salaries and everything goes up in industries that adopt certification programs, that it would be a big step forward if we could ever make that happen in the United States for the cleaning industry. It would really help differentiate in residential cleaning from the companies that are doing it the right way and creating value beyond just making things look good. And it would be able to command a higher bill rate for it.
Oh, Tom, this is my hospital ID card. On the back of it, it says I'm essential.
Oh, yeah.
I want every cleaning professional in the country to have something like this.
And during the last pandemic, that was a really big deal.
It was. I learned a lot. I know for a fact when here in Washington, D.C., and rightly so, I totally agree with the mayor put in a curfew. We had to work out how this disease was spreading, the COVID. We had to slow it down. We're still learning about the virus. And they put a curfew in, I think it was April 2020.
Okay.
And I was in a hospital that night. The curfew was started, I think it was like 8 o'clock at night, if I remember rightly. And I was in a hospital that afternoon, that evening, training cleaning professionals to wear the right personal protective equipment, eye protection, a mask to protect the nose, the mouth, and gloves, how to change with clothes so they didn't take the virus out of the hospital back home to their loved ones or into a supermarket or a restaurant, but how to be safer in the middle of a pandemic. About 8:15, I walked out of the hospital across the road and I was grabbed by 2 police officers. And they went, "What are you doing?" I went, "I just came out of the hospital. You saw me." "Oh, yeah, but the curfew's on. You should be off the streets." I went, "I'm going home." And I looked over my shoulder and the 15 cleaning professionals I had just trained were coming across the road. And I said to the 2 police officers, "They're all with me." I said, "Yep, we're all family. They're all with me. I can vouch for these people. They work in the hospital," and they could see them coming out.
Yeah.
What I'd realized is that I had a hospital ID card that said I had an emergency pass when there's an emergency, and they didn't have anything.
But they needed it.
And I thought, let's just look at the hospital. All the workers that are required to run that hospital, the doctors and the nurses and some of the other staff had an emergency pass, but not everyone. And then they put a lot of us into hotels around here in Washington, D.C. in the first few months of the pandemic, so we didn't come home from the hospital and infect our families. And I thought, well, the people who are cleaning the hotel every day, they don't have an emergency pass, and they've got to travel from the suburbs into town when there's a curfew on. And so how do we work together to create the fact that cleaning is essential? We know that cleaning for health is what we're talking about today, but more importantly, the workers are essential and they are recognized for that.
So you mentioned the healthcare setting, and we were chatting a bit before we started in terms of some parts of the world seem to put more of an emphasis on cleaning for health than others, and the number of infections that are acquired in hospitals in the U.S. compared to like some European countries. You mentioned what they're doing in England now with certifications. I know, living here in the U.S., we think the U.S. is really the best at everything. But from a cleaning standpoint, is it fair to say that the U.S. doesn't put as big an emphasis on cleaning as some other parts of the world, and maybe as much as it should?
Oh, that's really interesting, Tom. I love you. I have a Southern accent. You can tell that. I moved here.
Yes, it's clear. It comes across.
I moved here about 24 years ago. I'm an American citizen. I love living here, and I love living here because of the opportunity and the potential, as you and I talked about, going to scale, doing things big, doing wonderful things at scale. But the fact that we live in a country that has states that are so different, we have cities that are so different, and the fact that we have industries that are different. We are seeing that in certain industries, food industry is a great one, where cleaning professionals are thought of at a much higher level than, say, back in other industries, whether it be transportation, airports, convention centers, hotels, or even hospitals. I was recently down in Virginia, and I hopped on a school bus, and there was a first aid kit, and next to the first aid kit was an infectious disease spill cleanup kit.
Okay. Kids get sick on the bus.
Well, kids have vomit and diarrhea, and I hadn't seen this before. And I said to the bus driver, I said, "You trained in first aid?" "Yep, every year." I said, "But you haven't been trained in that?" He said, "Yes, I have." And I said, "What do you mean?" He goes, "I got trained on how to clean up vomit, diarrhea, or any other bodily fluid, even blood." And I said to him, "No, you haven't." He said, "Yes, I did." And he told me the whole story. And that was in Virginia. And then I went to Atlanta, and I heard the same story in Atlanta on the school buses. Then I hop on a plane to come back, and I said to the flight attendants, "Do you have a spill kit on your plane?" "Nope." And I happened to actually sit in a seat on the plane where there was blood on the armrest and the tray table. And I said, "Well, do you have a spill kit? Because I can't sit here for the next 3 hours. I don't know what the risk is. And I'm an infectious disease doctor. This is what I do. I'm an epidemiologist." And they went, "Oh, we've got a bottle of water and some paper towel." And I went, "Hang on, I've got better stuff in my bag. I'll do it for you." And they didn't have a spill kit. So how did the bus driver who drives the kids on the school bus is trained in health and safety and proper cleanup procedures for infectious diseases and knows it? It told me so much about what that person could do. And I went, wow, expert. I get onto other transportation hubs like planes and trains, etc., and I'm not seeing that. So where's that? It's the consistency is the challenge we have in the US. It's taking something that we know is valuable, it works, it makes the building healthy and safe, and being able to apply it across all 50 states is a challenge for us.
Oh, yeah. And wow, there's a lot of ways that we could go with this thought, because not everything you hear about cleaning is necessarily true. And some things you hear about cleaning, you're hearing it because somebody has a vested interest in maybe sharing something that's not completely true. And is there a reason that school buses that are basically fall under the jurisdiction of some local school district have higher safety standards than national airlines that are run by really large corporations with lobbyists who are being paid a lot of money to affect the regulations that affect the industry? There's a lot of legislation in Congress right now about changing some of the rules in the airline industry, and they start off with some very stringent rules. A lot of it has to do with reimbursements for fees and things like that, and it's watered every other day or so. It gets watered down more. And I don't want to get political, but it's not an accident that these things are happening.
But it's something that the cleaning industry, united as a group, as a team, can do. We can advocate for that. We can advocate that in those areas where there is gatherings of people, there's crowds, people move in and out. The risk is there if we don't do it properly. There are so many sectors, Tom, where people have to learn to do what I call spill cleanup, vomit, diarrhea, blood at a minimum.
Yeah. And ISSA, just for our audience's benefit, and for the week that we're in DC, we were in Rockville, but you left the event that we were doing, and you were part of an event where you guys were meeting with Congress, right?
Yep.
ISSA has its own lobbyists. Part of being a member of ISSA, including ISSA residential, a big part of what you pay for is to have people in Congress who are actually trying to represent the interests of the cleaning industry. And I mean, we want to build businesses that are going to be, successful for the benefit of the people who are taking the risk to run them, but also for the other stakeholders, for the people who provide the service and the customers that they serve. And a lot of times, all of those stakeholders are underrepresented because there's people with other interests that really don't want to invest in cleaning if they don't have to, because I guess that's more money going back to their stakeholders. I don't know. I
No,
do.
it's one of the reasons, Tom, that I like working for ISSA. The number of things that all of our different teams do. We have a wonderful government affairs team, and they work really hard and they're very effective. And we had a large cohort, a large group of people that came to that 2-day ISSA government affairs advocacy event. And for the very first time, it was a lot of people for a lot of the people who attended, they'd never been to Congress. They'd never met with a senator or a congressman. They'd never met with the staffers. So we did some training the day before on how you talk when you come to DC,
Okay.
how you get your message across. What are some of the areas of concern that we had and how we get in there? They took the second day, all the teams went up to the Capitol to meet with, so many different politicians, so many different people from both the Senate and the House of Representatives to get those messages across. And the key messages, the fact that safety is an issue. Safety is not a competition for us in the cleaning industry. It is an issue that we have to focus on. Do you have gloves? Do you know how to put them on? Do you know how to take them off? Do you have eye protection? Do you have protection for your nose and your mouth? Do you know that those chemical ingredients in that cleaning product, if not used properly, can hurt you? And if you're not trained properly on how to use them, because I can train anyone to use any cleaning product, to use it safely, no matter what it is, well, no matter what the category is, but you need to be trained to use it safely for you as the user, you as the cleaning professional, and then also you to clean the environment, the built environment, the inside building safely, what chemicals work on what surfaces without damaging them. So we brought up, and we're still working really hard right now on these issues, like, what is the ability for cleaning companies and cleaning professionals to get personal protective equipment, gloves, eye protection, masks, even coveralls or gowns when there's an emergency. Not just infectious diseases. Look what's happening in Texas right now with the flooding. Look what's happening in the Midwest the last couple of days with the tornadoes and the heavy rain out there. All leads to challenges, and they're challenges that we can meet with proper education and training.
And in an emergency situation, a lot of times it's all hands on deck, kind of like during COVID. It's like, well, we just clean homes, but house cleaning professionals were essential as well. And they were playing a larger role, or had the opportunity to play a much larger role than just making things tidy. There was an infection control component of that as well.
Yeah, there's 3 areas that everyone should be rethinking on what they do on a daily basis in their job. Air is one. Air quality has become a real issue for the clean industry, and we need to know how we impact the air when we clean. We need to know what good measurements are for indoor air quality. Surfaces, we need to know more about the surfaces that we clean, both the hard ones and the soft ones. And we need to understand water, how we use water, but also the fact that water or wet surfaces leads to problems. And the fact, so it's air. I really think air, surfaces, and water are probably the 3 key areas that we as a profession need to focus on and manage better.
So you were talking about measuring earlier. So when it comes to air, I know that there's like particle counters that are out there. Some of them are, you can go to Amazon and buy them. I mean, if I'm running a house cleaning company, is there any value in investing in that, or some of the equipment we could talk about to measure surfaces and other things? Is that something that applies to house cleaning?
Well, this is the challenge we've got, Tom. There's so many pieces of equipment out there for the cleaning industry, how do we help the cleaning companies and the professionals choose wisely on equipment that works? And this also goes to, I have probably 5 indoor air quality monitors in my home. Why? I just love the numbers. I love seeing them go up. I love seeing them go down. But more important, it gives me an indication of what's going on in all the different rooms in my house. I use those indoor air quality monitors to whether I need to increase ventilation, open a window, turn a fan on, and I use them by looking at the data. And those indoor air quality monitors are affordable now. You will see an increase in certain measurements like VOCs, the volatile organic compounds, when you clean, but then they go down again. So there's nothing to do there.
Right.
You will see, again, we know we can measure ozone, but more importantly, Tom, we can measure particles now. And let's think about this. What can we see? And I know I'm in my late 50s now. I can't see as well as I could a few years ago, but we can probably see the thickness of a hair.
Okay.
And the thickness of a hair is about 50 microns. But I probably can't see much less than that. But the things that hurt you down at 10 microns, or more importantly, the bacteria, the viruses, the fungi, the mold down at 2.5 microns or even 0.1 micron, we can't see that.
So a hair is like a beach ball compared to a grain of sand when you start talking about the things that can hurt you that you can't see.
So how do we make that, all those invisible substances, the droplets, the pollen, the dirt, the chemicals, the particles, how do we make them visible? Indoor air quality monitors do that. Particle counters do that for us.
Sure.
And then when we see that, we see those numbers, we go, nothing to do here. Those numbers are fine. Or hang on, wait a minute. I've got too many particles in the air. What do I need to do? Or I have too many gases or too many volatile organic compounds. What do I need to do? And being trained to have that mindset, that ability to see a problem and then address it with a solution that works is where the industry is going, and it is going very, very quickly. And it's all going to be based on metrics, measurements.
So let's talk about a moment why that's important, because we've all been living indoors for 90% of our life for some time and breathing whatever the air it is that we're breathing. And as a rule, it's not anything that is acute. It's like all of a sudden I'm, sick. I mean, it can be, fringe cases, but as a rule, we can breathe unhealthy air day after day and kind of function and not know the difference. But, why does it matter?
I think it's really important, Tom. Again, we know we spend so much time of our life indoors.
Yes.
But the information we have is really more about outdoor environments, pollution outdoors, air quality outdoors. We don't have those measurements indoors where we're spending most of our time. A lot of people say, oh, yeah, I wake up every morning, I've got a headache, or I have a runny nose, or I have a cough, a dry cough. But, whoa, that's not healthy. That's not what I can fix that for you. With the proper training, people can help you with that. Let's start with an easy one. A lot of the cleaning products that we use do have some chemicals that could trigger, for example, asthma.
Right.
Wouldn't it be great if we could educate and train all of our cleaning professionals on going, here are the triggers for asthma. If you're cleaning the home of people that have asthma, then you should be able to say to them, the products I'm using today don't contain those asthma triggers. Wouldn't that be a wonderful conversation to have?
Yeah. And especially like kids and things like that. The other part of this is there's not a large body of data of the long-term effects. It's kind of like smoking. I mean, it's a bad idea, but if you smoke a cigarette today, you're probably going to live to tell about it tomorrow. But if you do it every day for a long period of time, there's data on that suggests you're shortening your life. And, I guess there is a school of thought out there. I don't know how much empirical evidence it is, but, the better the indoor air quality is, the better your health is going to be long term.
Tom, there are studies There are studies that have been done that have been they get put into journals that you have to pay money to access that none of us know about.
Okay.
And here's the big challenge between reality, working on the front lines, and looking at the science and the research. The information that's there is not, we can't access it. How about if we created a training academy, the cleaning university, that allows us that do have access to a lot of this research, be able to then translate it into a way that's understandable. I was recently at a meeting at the National Institutes of Health, the NIH here in Washington, D.C., where we talked about the impact of cleaning products on people. And they have probably 40 years of research. And if they added it all up, about 115,000 nurses have been studied over the years for the impact of the chemicals in cleaning products, the effect it has on respiratory systems, on asthma, on headaches, on skin, on cancer, on dementia, on so many different areas of health. But the fact when we go to the hospital, it's not the nurses that are actually having the direct contact with the chemicals in the cleaning products. So it's like studying secondhand smoke.
Okay.
So hang on, I said to them, but the smokers are the cleaners. The cleaners are dealing with the chemicals in the cleaning products. Where's all the studies on the cleaning professionals?
8 hours a day, 5 days a week. Completely different ball game than what the typical consumer gets when they, if they're cleaning their own shower, a couple times a month.
And so we know that working with chemicals in cleaning products, because this is how cleaning products work, they need chemicals, but they can cause coughing, wheezing, red itchy eyes, skin rashes, shortness of breath, sore throat, headache, dizziness, nosebleeds, asthma, we know that, skin irritation. So we know there are health effects, and they're on the labels. And if you can't read the labels, because my eyesight's not that good anymore, Tom, and the font's too small. And then we go to the safety data sheets, which are really hard to find, but they're there. You've got to then read the safety data sheets and understand what they're saying. And they use a lot of generic terms like, dispose properly. I'm going, what does that mean? That doesn't tell you how to do that. Or I looked at a safety data sheet the other day for a common cleaning product, and it said, wear the appropriate personal protective equipment.
But they don't tell you what that is.
And I went, what's appropriate?
Right.
It said, wear the appropriate personal protection. This is real. This is actually on the safety data sheet. And I went, that doesn't help us, because then we've got to go back and say, and that becomes so subjective. Everyone goes, oh, well, I thought it was this. Oh, I thought it was that. No, it's not. Yeah. This actual chemical, guys, can do this. And that's why you have to protect your eyes, nose, your mouth, and your skin from the chemical. And we can do that for anyone. But here's the challenge we have, in that there's a lot of research, can't access it. We've got a lot of people with opinions, passionate, that's wonderful. And then we have things like safety data sheets, which are either hard to find, and if you do find them, they use language which is not really specific or helpful.
They're not written. They're not written like marketing material. They're not written in a way where they really are trying to encourage people. It's kind of like the instructions on a back of a bottle of disinfectant. Nobody reads that. Everybody uses disinfectant in a way that they shouldn't. It's regulated by the EPA the same way as pesticides are. And we're spraying it all over the place. We're breathing it. And we're not even cleaning the surface and letting it dwell for 10 minutes and removing it the way that they tell us. So it really isn't having the efficacy it's supposed to either. We're jacking up the indoor environment and getting very little for it.
And in 2024, Tom, we're still expecting people to sit down and take the time to read something.
Yeah, that's
everyone carries one of these. And what do they watch? They watch videos.
We need to put it on TikTok.
Well, whatever, but we need to create videos. We need to create videos on how to clean for health and safety. We need to create videos on how to handle the chemical products safely. We need to have videos on how to put on and take off the personal protective equipment that's appropriate safely, so that it's standardized. So you and I have got 1 million people out there all doing the same thing, and we can sleep at night. That's what we need to do.
The people that are doing the work are safe. The people that are doing the work for are safer. I mean, it's
Oh, Tom, I see so many situations where we're going, oh, I know you're doing your best, but that's not safe. And then I talk to people, I talk to veterans, I talk to people in the industry that have been doing this for a long time. And I said, how do you feel? Oh, well, I'm short of breath. Oh, I get headaches. Oh, and
yeah.
I know where it's coming from. And I know more importantly, Tom, it could have been prevented.
Okay. So we talked about air, surfaces, and water. If you had to rank those, do you think air is the out of the three, the most important thing that we should be spending more time thinking about?
I think it's an area that we need to put more focus on because dirty air leads to dirty services, and dirty services leads to dirty air.
Okay. So
And
the products we clean with are a contributing factor to that, both, I guess, the cleaning agents as well as the equipment, vacuum cleaners with good filtration would be part of that, I would assume.
oh yeah, that's great. It's so important. The technology is there now for a vacuum cleaner to be very safe to use because it'll have a HEPA filter in there, and the way they're designed now make them much safer than they used to be. Because they used to, you could actually measure the number of particles kicked up by a vacuum cleaner, for example. But a lot in my cleaning for health workshops, I ask people to bring their vacuum cleaners to the workshop, Tom,
Mhm.
and then I go, "When was the last time you cleaned your vacuum cleaner?" And everyone goes, "Oh gosh, he's going to look at the vacuum cleaner, isn't he?" I'm not here to embarrass anyone, but I'm going to show you how to clean this vacuum cleaner in a way that makes it safe, healthy to use in the next indoor space.
Right.
And it's very quick. It's very quick. Not a lot of effort, not a lot of money, but it's something you need to put more attention on. How do we clean our mops and our buckets? How do we clean our microfiber, our cleaning cloths? How do we clean the equipment that we use to ensure that cross-contamination, moving pathogens, infectious germs from one area to another, like one house to another house, or moving chemicals from one house to a house doesn't happen?
Or even from one surface to another. Don't use the same cleaning cloth you use to clean the toilet to clean the doorknob.
Yeah, so that's where we bring in the color-coded systems. So this is where it gets really exciting because now you're putting in systems and processes, and you're showing that what we do is done through training, it's done through evidence, it's done through science, but it's done in a way that creates a safe and healthy space, both for the user as well as the professional, the cleaning professional. And that comes back to our conversation, Tom. That's why we're essential.
Yeah. So if we're running cleaning companies, we have an obligation to educate our customers on these matters and then demonstrate to them that we're doing more than just making the home tidy. I mean, I work with a lot of cleaning businesses, and one of the common themes is, well, how do we differentiate ourselves? There's people out there that are doing cleaning services for rock bottom prices. I can't run a real business for what our competitors are charging. And the competitors aren't offering the same value as you are, but we aren't telling people.
Oh, I think what I loved about our visit that we had just recently, in Apop at Rockville, the fact that what you showed me, it made central the business tools, the processes you have, the way that you're helping companies be more professional in the way they actually work as a company. We take, again, the whole systems approach, being very holistic. Yes, we've got to help people manage the business, and then we've got to help people do the job, the how. And that brings it all together in one big comprehensive training program that we put through an academy where, yes, you learn cleaning is a business. We teach people even how to fill out their tax forms, because I still struggle with that. But we teach people how to fill that, but how to run it as a business that they can live off. It does well,
Right.
supports employees, but also focuses on health and safety for those employees, as well as health and safety for the building.
And running it as a business means that you're profitable and you've got the free cash flow not only to have great benefits and compensation for your cleaning professionals, but also have the money to invest in training. And there's a misconception. I have the opportunity to look at a lot of data, and there's a misconception that I can't afford to spend a lot on training because I have a lot of turnover and I have to train a lot of people. And the secret is, if you have better training, you invest more in training, you're training fewer people because your turnover goes down, you're getting better outcomes, your customers are happier, and you have more customers, and you're more profitable. It's counterintuitive. The problems we have, the root cause of a meaningful amount of it is a lack of training, and thinking that we can't afford it is really making the problem worse. You can't afford not to.
And with the resources that you have, Tom, that ISSA have, we can really put together a good career pathway.
So we're pushing up against the top of the hour here. And this discussion here, we're going to have the opportunity to continue it here in a few weeks. We are going to be doing a workshop at Gosha Barron's place in Chicago. And Gavin, you're going to be taking a lead role in that, aren't you?
Yeah, no, I think what we found that the workshop we did in Rockville, Maryland was just a good collection of the right people with the right messages, it was really useful for the attendees in that they actually got a lot of the feedback that I've received, Tom, was that people went, wow, I learned something. If people can come to these days, the residential cleaning events and learn something, then that's what we're intending to do. So it's building upon what we did back in April, and then going to Chicago in June to build upon that to help people in that area.
So this event is going to be June 9th. That's a Sunday. It's an all-day event. It's at Gosha's place. And I've had the opportunity to visit Gosha's before and attend events that she's hosted there before. And I tell you, the catering alone is worth the price of admission. Anything that you learn is just a bonus, but you're going to learn a ton too, because I've seen the presentation that Gavin's going to be giving us, and it is going to be, you're going to be bringing ATP meters and other tools. So we're going to be talking about objectively measuring clean and putting it in the context of how cleaning business operators can use that information to build better businesses and get safer outcomes for their technicians as well as their customers.
No, you're right, Tom. We want to help people move from just they think it's clean to they know it's clean.
And I dropped the link to that in chat. You can sign up right off of the link that I dropped. And we're going to have some other speakers there. Gosha is going to be presenting. RJ is going to be there, and Ricky Regalado. If you ever heard Ricky speak, he's very dynamic, has a pretty significant leadership role in the commercial cleaning world. He lives in Chicago as well. I know that he's going to do an awesome job. We're going to have some Made Central folks there. We're going to do a workshop on artificial intelligence. And basically, we have a number of AI tools that you can use in your cleaning business. And we're going to be just showing you a bunch of AI hacks, if you will, and you're going to walk away with some things there that'll be useful. Philmon was also with us up in Rockville, and he is going to be talking about VAs and how to leverage them as a resource in the 21st century. So,
and that's a session not to be missed. That was fantastic. I really enjoyed that one.
Yeah, he's VA. The IE of VAs has been around for a while, but he's taking it from a different angle, and it's worth hearing it. While you are in Chicago, there's another event on the following day, which is a Made Central event. It's a full day event, a one-day event, and it's dedicated all to artificial intelligence. We're going to have several members of Made Central staff there, and we have a long list of AI tools, everything from large language models to models that can do graphics, can automate your marketing process, automate your sales process. If you're interested in AI agents, bots, if you will, we're going to show you some things there. If you want to learn how to build websites using AI, it's going to be a full day hands-on workshop. Bring your computer. We'll be doing stuff together. And I promise you, by the time you get done with that, you're going to leave with some information that's going to make you and your leadership team a ton more productive in doing the things that they need to do, leveraging the tools that are available today, in the artificial intelligence world. I
Just
dropped a link to that there
Just
too.
on that, Tom, I recently just saw a new vacuum cleaner that's out that actually connects to your cell phone and shows you areas that you've covered in the room and the areas that you've missed. And I went, what a wonderful use of technology. That's fantastic. And it paints like a picture. You went across this area of the room, but here's the areas, the gaps that you didn't cover with the vacuum cleaner, so you can go back and fix it.
Wow. I might have to get more information about that. We'll incorporate it in our workshop on Monday. I haven't seen that.
Yeah, and this is what's so wonderful about innovation, technology. I know you've mentioned here the AI revolution. It can be used for benefit. It can be used for good in our industry. And it's so important that we learn how to use it for solutions.
So if you have the opportunity to join us in Chicago, we would encourage you to do it. It's going to be fun. It's going to be educational. It's going to help your business. It's going to help the industry. Dr. Gavin, as always, it's a pleasure. You're so much fun. And I feel like we just scratched the surface. We could do this for a while more, couldn't we?
Well, it takes a team, Tom. So always a pleasure to work with you.
Well, we're going to go ahead and we're going to call this a wrap for the day, but we'll be back next Wednesday, 5 o'clock Eastern. So until then, everybody take care. Bye-bye.
Bye now.